Away from education, within the last 24 hours, the Ghana Health Service has reported of 4 more people dying from Covid-19 in Ghana, bringing our death toll to 320. 64 new cases were also recorded within the same period. Our current active case count is 566. Now, this number is very, very low in comparison to the hundreds of thousands recorded in other countries, especially in Europe and the Americas. But here's why health authorities are beginning to get worried. On the 11th of October, we had 18 new cases and 301 active cases. Do you see the difference? But it's not just about the figures, but the alarming disregard for safety protocols by citizens and the correlation between that and our increase in case count. Listen to Deputy Health Minister Dr. Okoboy, who says non-compliance of safety protocols is becoming alarming.
There are folks who assume that the pandemic is over in this country. People even sometimes ask me, Doctor, why are you people still wearing a mask? The virus is gone. But fighting an infectious agent is like fighting a bushfire. Until the last one is extinguished, really the situation can get worse again. So let's all take this opportunity to remind the public and ourselves that we are still in this war and that it's only when the last soldier is cut out that we can take a breather. So on this note, we thank you very much. We assure you of making sure that we supervise an equitable and fair distribution and also support our agencies to make sure that whatever you've provided is put to very good use.
The Deputy Health Minister was speaking at an event where MODEC presented some PPEs to 4 COVID-19 testing centers. But here's Ashanti Regional Director of Health, Dr. Tinkrang, who is warning Ghana could experience a second wave of the coronavirus outbreak if citizens do not observe safety protocols.
The only reason why we are not getting the morbidity and then the mortality is because of the strategies that we've put in place. And everybody is working at it. But if we leave out this strategy and think that without the strategy we can just go about and do our normal thing, and COVID will still remain as low as 2 maybe per week in the Ashanti region, then we are lying. Because it's only one case that you need to escalate the number of cases that you have. So once we are getting 1 or 2 cases, if we are not careful and then we don't adhere to the protocols, the possibility that the cases will come up is also very rare.
But why aren't people wearing masks? We spoke to some Ghanaians on the streets of Accra.
I do take the local trusty that's what it is. Even the driver himself isn't having the nose mask. Personally, for me, with what's going on right now, for me, I'm not really sure this is still in Ghana. I believe I can. If it is in Ghana, I believe I will be having it now because I myself am not really practicing the necessary measures, but I'm still not affected. And we are in the election year. I think last 2 weeks, there is this party that went on campaign, and the mass, there were even more than people in my area, and I haven't heard of any of them getting affected. So for me, I don't believe it.
As before and after the lockdown, before the lockdown was good, but after the lockdown it isn't good at all. Not really. Even the drivers and the mates and the passengers, the most at times, if you go and talk about it, are you for me, are you doing this side rubbish? So I'll not do it, I'll walk or you get taxi or anything. It's still real. Yeah. It's still real. No light. And the max don't care. Personally.
So you had some Ghanaians admitting that they no longer wear the mask. Let's now speak to a member of the COVID task force, Dr. Abajida Costa. Thank you so much for your time here this morning, Doc. So we've heard the experts. Deputy Health Minister has spoken, Director of Health of the Ashanti region, and many others are concerned that the blatant disregard for adherence to safety protocols could get us to a point where we begin recording higher numbers again and possibly record a second wave of the virus. You've been on the ground hoping that education will do the trick, but it appears that's not happening. Tell us your experience.
Thank you so much. I think I share with the Ashanti Regional Director of Health Services viewpoint, and also what Dr. Okoboy said. Generally, compliance has actually come down. And I think Ghanaians should begin to realize that we only had 2 cases, and it took us to the 40,000, over 45,000 cases that we recorded in the country. So we have to guard against the successes that we have had over the last few months. So by this, I think Ghanaians must actually comply. Individual responsibility is very key here. People should know that they have to protect themselves because the country cannot afford a second wave. We leading the education we've been doing our best. We've tried all the strategies. Like we are now engaging the Regional House of Chiefs. The president, in all his speeches, has been advocating that we should comply. Regional health directorates are doing their best. NGOs, CSOs, the media. So I think it's a personal responsibility comes in this. And it is key also in behavior change, because I do not believe that no one in Ghana here is not aware that COVID-19 is in Ghana. Everyone in Ghana do know that the disease is in the country. It's just the low perception that the disease is gone. So it's because of the successes that we have achieved. So they believe that the infection is no more. And again, I think the period at which we are, the political season, politicians are campaigning, and it is also important for us to advise that during their campaigns, they should use the opportunity to disseminate the COVID-19 messages. And also, they should be sharing the nose masks and encourage people to wash their hands before they come to their events.
All right.
I think that's important. Yeah.
Doc, we've tried education, we've tried advice, but there's an element in all of this that appears to be missing, which is the sanctioning. People who do not wear masks can be picked up by the police, can be fined. And so why aren't we doing that? Is it not clear that the education and the advice may not be doing the trick for us?
Okay, yeah, so thank you. Like I said, if you look at the season we are, I mean, political campaigns are ongoing. The police do guard against those things. And also, bear in mind, this is mass non-compliance. It's not just 1 or 2 people not complying. So certainly, our prisons are also congested. So we certainly have to find a way around this. But people
can be fined. It's not all about taking them to prison.
So maybe the non-custodial sentences, those one can do the trick. And I think if you remember, when we started, the municipal authorities were actually giving sanctions. And I think we should go back to that. I don't know in legal terms, how whether it's legal or not, but I think some of those sanctions will be able to deter people from non-compliance. I mean, people should comply. Like I said, the thing is, regardless of how you look at it, we are losing our guard, and we are losing. I mean, obviously, we certainly have to comply.
Doc, in other countries, in France, for example, there's lockdown, and in other places, people are beginning to review their decisions about allowing people to go to pubs and go to school and all that. Should we begin to look at that? Because clearly, from what I get from the health authorities and the sense I get is that we are not in a good place.
Okay, so you see, our strategy has been consistent with the successes that we have actually achieved. And if you remember, if you look at the measures that we've put at the airport, in fact, now where we are is we are the containment stage. So this is why we contained it to the extent that we got to about 300. Though it's gone up slightly, but you could also imagine that because we've opened the borders, so the cases in the at the airport is also contributing to this increase. So for this reason, I think the measures at the airport is good to help us detect the cases. So that is why we are saying that when you are coming from Europe or any of the countries, you have to have a negative PCR test at least 3 days before you come to our country. And when you get here we will test you. So the measures there seems to be very strict and it's working for us. Now, we in the country do have to comply with the safety protocols. That is the only measures that we have to guard against any increases.
All right, Doc. Sorry, let me just come in here. So, compliance, but that does not appear to be happening. There's a lot of non-compliance in our public transportation in many places, public places. So what should be done? What should we be doing? Should we be looking at reviewing our restrictions? Should we be going back to closing down some public places and all that? Is that what we should begin to do?
No, I think we are not yet. We are not there. We are not there yet, because certainly, if in public health we deal with predictions. Certainly, when we were easing, we certainly knew that certainly the infections could be going up, but that was not what was happening until recently. So, like I said, there is some. You could see that some activities have been intensified, and because of this, I think we certainly have to encourage those leading those activities to make sure that they either distribute the masks or force members to comply. And in doing that, they can help by distributing face masks, for example, to people who come to their events, by also making sure that they use their platforms to disseminate COVID-19 messages. You see, look, for us in the health sector, as we speak, my group, they are on the field, still continuing to engage the various stakeholders, trying to make sure that people understand what is happening. So we are doing everything possible, but the disease actually spreads with activities. So it is important that those leading those activities follow the measures that we have put in place, and the measures. Those measures are what is going to help us. So, like I was telling another media house, you see, for example, even if you look at our media houses and practitioners, now in their various stations and studios, they are not wearing the face mask, but these are people look at them as role models. So it's a collective effort that we all have to put in to make sure that we curtail this virus from our country. So the responsibility is on all of us. But the point is, individual responsibility is key in reducing this virus in this country.
All right, Doc. So you've mentioned activities as being the fuel for the spread of the virus and how it's affecting our fight against COVID-19. But just tell us on the front line, really, what's happening and with regards to emergencies and how you're handling that in the various hospitals.
Well, I think, like I said, there's a slight increase. That is not to say our hospitals are overwhelmed. Our hospitals are not overwhelmed. We still have spaces. In fact, most of our places are empty, and what we are guarding against is not going back, because I think that the health system has gone through a lot of stress, and we certainly have to avoid a second wave. So for us, we also believe that the infections were at the various health facilities. So we continue to engage them to ask them not to relax, but to wear the mask. So if you go to our health facilities, you see that health managers are making sure that people comply with the safety protocols. We should also serve as examples within our health facilities. Next week, for example, from Monday, my division is doing training on risk communication for our health facility managers in Kumasi. Others are ongoing in anticipation that maybe there could be a spike. So certainly, we are certainly working. We are using all the methods at our disposal to ensure that we safeguard against the successes that we have achieved.
I appreciate your time this morning. Dr. Abajida Costa is a member of the COVID task force team here in Ghana, and you must comply to safety protocols.